Got it. So welcome everyone. Welcome this morning for our World Bank Live event on obesity, time to act. Thanks a lot for those in the room coming out on a very rainy day. We're happy to have you. And we have a large group online also because this is going to be or is streamed online. So we have colleagues joining from many countries. We will have a live chat going on. So those online, please do send in your questions, both in Spanish and English. We have simultaneous translation in Spanish. And we will answer those questions online while the event's going on, and also send some questions up to the panelists to answer those. So without any further ado, I want to introduce first Dr. Muhammad Ali Pate, our Global Director for Health, Nutrition and Population, to come on to the stage here. Why don't you sit here first? He will do opening remarks in a moment. And I may also invite the other panelists to come up. Mira Shekhar and Barry Popkin are the co-authors of the report that we will be discussing this morning. Mira will also then be the moderator throughout the session. And we have Marie Rule from IFPRI, who will also join us on the stage as a panelist. And we have one colleague online, Adancha. She will be introduced shortly by Mira. So I'm handing over to you.
Okay, thank you. I think I want to start with inviting Mohammed to give us his opening remarks.
Very good. Thank you. So let me start by saying good morning to all of you and to welcome you to this launch event on obesity, time for global action. And especially to Ambassador Tsukada, who has joined us from Japan. For a very long time, we've thought that obesity is a problem of high-income countries. But it is clear that this is not true any longer. In 2016, over 2 billion people globally were overweight or obese. More than 70% of them lived in low and middle-income countries. Today, obesity-related diseases and overweight-related diseases, such as diabetes, cancer, cardiovascular diseases, are among the top 3 killers in all parts of the world except in sub-Saharan Africa. And in 2019, estimated 70% of the world's adult deaths were related to non-communicable diseases, including the obesity-related diseases. And the factors escalating the obesity epidemic include high ultra-processed and sugary foods that are becoming more readily available, and declining levels of physical activity as technology is replacing physical labor. One of the factors driving the rise in overweight and obesity is the changing labor markets and the impacts on women, with more women entering the formal labor force in large populations in most countries. This is requiring changes in food systems. But we also need to pay particular attention to addressing the gender differences in obesity. The increase in obesity has had major impact and is going to have even more impact over time on national economies and human capital by reducing productivity, life expectancy, increasing disability, as well as cost of healthcare. It is projected that in the next 15 years, cost of obesity will exceed $7 trillion in the developing countries. In China, between 2000 and 2009, the healthcare costs of obesity have increased from 0.5% to 3% of annual health expenditures. In Brazil, obesity-related healthcare costs are expected to double from 2010 at 6 billion to more than 10 billion by 2050. And many countries in the globe are now facing what is known as a double burden of malnutrition, stunting on one hand and obesity on the other hand. And that is further constraining their human capital. Now, to avoid the rise of obesity in future generations, countries, their governments, and development partners must adopt a comprehensive, multifaceted, whole-of-society approaches, which include focus on prevention, and better primary healthcare services. By proactively dealing with this, countries will be able to preserve and accumulate their human capital, and they will be able to sustain and improve their economic growth through healthy and productive workforce. The promising interventions to tackle obesity include mandating the labeling of processed foods, consumer education, strong fiscal policies such as taxation of unhealthy foods, investing in early childhood nutrition programs, and enhanced urban design and transport, such as through playgrounds in schools, walking, bicycle paths, and increasing access to healthy foods, such as fruits and vegetables. Stronger primary healthcare systems will provide an important entry point for individuals into the health system and improve countries' ability to prevent obesity and manage the increasing burden of chronic diseases. Digital health and digital technology and innovations can help us link personal preferences of individuals and their behaviors to tailor healthcare providers' ability to deliver precise medical solutions. From the bank's perspective, I think we have not done as much as we need to do. So we have to do a lot more on this particular issue. We are currently in the midst of refreshing our strategy with a focus on strong primary healthcare systems as foundation for achieving universal health coverage. And there are examples, not enough examples, but some examples where our interventions have been able to help countries move in the direction of tackling with, the rising obesity in their respective nations. For example, in Tonga, there's a development policy operation that is demonstrating the impact of taxation policy on consumption and health. In Saudi Arabia, our teams are assisting the government and considering strategies to reduce obesity, including sugar-sweetened beverage taxation. Our colleagues in the transportation sector have been supporting non-motorized transport planning in some cities, such as in Lima, Bogota, Manila, and Manila. These are likely to increase physical activity, and over time we'll see whether it improves health. We hope to use this body of work and the initial sets of experiences as take-off points to deploy all the tools that we have at our disposal to help prevent obesity as part of our strategy refresh at the bank, using our analytical and advocacy tools, our investment tools, and policy tools such as the DPO to address issues such as legislation and marketing controls. This is the time to act, and it's the time to act together. And no single entity can be able to do this alone, which is why we are working with partners. We are working with WHO, and there have been several other commissions, including the Lancet Commission, which many of our panelists also participated, that have tried to quantify and make recommendations on the potential solutions to this problem. Today, this is the launch of the report, and you'll hear more from the experts who've put it all together. You'll hear from the Lancet Double Burden Series, which Marie participated in along with Mira Shekar. My colleague Mira Shekar is the global lead on nutrition. She was a commissioner on the Lancet Commission, but also she co-edited the book that we are launching today. And Professor Barry Popkin, who for several decades has been working on this and has joined us from the University of North Carolina. He also participated in the Lancet Commission as well as in co-editing this report. And of course, most important is our country clients. The minister from Pakistan was supposed to join us this morning, but unfortunately, due to last-minute hitch, she was not able to make the connection. She's traveling at the moment. But we're very pleased that we have our colleague, Aranza Colchero from Mexico. She's connected virtually, and we'll hear more as to what Mexico is doing in this area. And I will have to acknowledge the role of the government of Japan, which supported much of this work in collaboration with our teams across sectors. And Ambassador Tsukada, who is the Director General for Global Issues in the Japanese Ministry of Foreign Affairs, is here with us today. signifying the commitment of the government of Japan in this area. And also the positive example, because Japan is the country that has the least obese population in the world. So there's a lot to learn from government of Japan. So I want to welcome you all and thank you for spending the time to join us, and also those of you who are connected online to join us in this conversation. Thank you very much.
Thank you. Thank you very much, Mohammed, for those inspiring words. So some of us work here at the bank, and we do the analytical work, and we make the rationale for why we should be acting. But Mohammed is the one who's going to then help make sure that we act in that direction. So thank you for that inspiration. Before I present some of the top-line findings from the report, I also want to say that this report, though it was led by the Health, Nutrition, and Population Global Practice at the World Bank that Mohammed leads, we actually have had amazing collaboration from across the bank, from the Agriculture Global Practice, from the Transport Global Practice, and several other practices as well. So this is really a whole of World Bank report, not just a health sector report alone. So with that, let me start to present some of the highlights of the report, and I'm going to invite Barry in a few minutes to come join me in co-presenting the report. Okay, so for some reason, this is not moving forward. Okay, here we go. Now it's moving too fast. Okay, so the report that I hope you've all had, you've all been able to get a copy of the report outside, and if you haven't grabbed one, you're welcome to grab one when you're leaving. It really focuses on the health and economic consequences of something that we believe is a really big global challenge starting to manifest itself. And several people said, why are you doing this report now? Some people said, why didn't you do it yesterday? But really, it's because we, as you will see from some of the evidence here, obesity and overweight rates have been increasing across the world, particularly in low and middle income countries, and Mohammed referred to that already. We used to think it was a rich country problem. It's not. It has a huge impact on productivity and economic development, which is something, again, that we didn't necessarily recognize in the past. And while earlier we used to say we know where there's a problem, we don't know what to do about it, now we have growing evidence. It's not final, it's not perfect, but we do have growing evidence in terms of what works. And recognizing that governments have a key role to play, and the bank supports governments in that role, we felt this was a good time to do something like this. And I use the term the syndemic of overweight, undernutrition, and climate change. It's a new term that was coined under the Lancet Commission on Obesity, which really talks about these three things happening together and being synergistic. And these are all the three things that we worry about in the world today, among a few other things as well. So just to give you a flavor for what the problem looked like in the 1990s, you see, I'm not going to go country by country, but just by looking at the map, you can see that even in the 1990s, it was a big problem. And if you see what's happened in the 2010s, you see how much more the problem has grown. The rates of obesity and overweight have grown tremendously, especially in low and middle income countries. And that's been one of the major reasons for doing this report. The second big picture message is that nearly a half, about 44% of adults and 20% of children across the world are either overweight or obese. And that's really something that most people had not recognized up to now, especially if you think that children 5 to 19 years old, such a large percentage are obese or overweight. This next sort of really important thing from our perspective, from the World Bank's perspective, is that, as Mohammed was saying, a lot of these people live in low and middle income countries. We used to think this was a problem of rich countries, rich people. Not the case anymore. And if you see over here, more than 70% across all age groups. But if you see the children's this thing, which is that first box here, nearly 80% of these children, overweight, obese children, live in low or middle income countries. So really something needs to happen in these countries very quickly. And the other surprising fact is that more than 50% of the rise has been in rural areas. And that's why our partnership with our agriculture global practice is really important as well. If we look at the factors that affect overweight and obesity, it's always complicated, these factors, but we've highlighted 3 direct factors in the report. Excuse me. One is, of course, diet, which is absolutely critical. A second is around physical activity, which, again, is very important as well. But a third one is around what we refer to as early life nutrition and genetics. So children who are stunted early in life are more likely to be overweight and obese later in life, and links very well to non-communicable diseases as well. In addition to that, there are really important indirect factors, issues like food systems, issues like urbanization and the built environment. Those are absolutely critical as well in looking at how and why we are seeing these rises in overweight and obesity. If we look at the health impacts of obesity, certainly the links with cardiovascular diseases, very, very clear. The link with cancers, very clear as well. And then if we look, the links with diabetes, the evidence is very clear as well. And then, of course, other related issues as well, whether they're things like asthma or depression, the evidence on that is growing as well. So huge potential impacts of obesity on health outcomes. And these are the issues that are closely linked to excuse me, to the economics as well. Globally, we've seen that the costs are about $2 trillion, and that is huge in itself, because we are not worried just about the health costs, but also the economic costs. Thank you so much, Mohammed. If you're ever looking for a boss, that's the kind of boss you want. So going back, global costs estimated at $2 trillion. If we look across countries, in the U.S., they're estimated at about $147 billion. And I'm very purposively using the term estimated. In China, they're estimated at about $44 billion. In Indonesia, about $28 billion. But you will see that these costs are not always comparable across countries and across studies at the moment, because some of them are direct costs. The U.S. costs that are listed over here are direct costs, means costs associated with healthcare and so on and so forth. But if we look at the costs in China, those are estimated both direct indirect costs. And then in Indonesia, these costs are total costs, both direct and indirect costs. And indirect costs would be things, costs associated, for example, with absence from work, lower productivity, so on and so forth as well. So this area, there's a lot more work that needs to be done, but this just gives us a flavor of where we are headed. And another element that has not been quantified, remember the term syndemic, the links with climate change as well. But the costs of obesity associated with increased water use, increased carbon emissions are really important as well and have not been estimated as yet. I'm going to hand over to Barry now. I've told you what the big problems are. Barry's going to help solve the problems.
So essentially, we began this last 20 years with really no national interventions focused exactly on healthy eating, physical activity in a way that would affect overweight and obesity and all the nutrition-related non-communicable diseases. In the last 2 decades, particularly in the last 6 or 8 years, the area of taxation began with sugary beverage taxation, moving into much wider category of ultra-processed food, nutrient profiling models that identify foods that are unhealthy or very healthy and promote consumption of those foods, or promote not consuming foods like the ultra-processed foods, marketing regulations to children and also to households we now are getting evidence on, as well as on school feeding issues and marketing in schools and marketing. So those are all kind of the classical agendas related to diet. But there's another group that are really quite important. The urban design, as Mira mentioned, with some of the work the bank's doing across the globe, and also Mohammed mentioned, promoting really physical activity. The healthy diets are coming through the nutrient profiling and all the items on the left as well. And the food system, and how we change our food system to really incentivize healthy food and not the kind of sugars and fats that we've been incentivizing in the last decades, as well as animal source food, which feeds very much, if it's red meat, ruminant animals like beef and lamb, into a huge amount of carbon emissions. And so we have big problems in those areas. And then we have the bigger issue that many of the causes that affect undernutrition are now being linked to causes affecting obesity. Ultra-processed foods are now reaching infants and preschoolers in every country in the world that's lower middle income. And we now are beginning to see it associated with up to 20-30% of the calories of an infant in many of our countries, so that it's becoming a really huge issue in low and middle income countries. And finding initiatives that will both improve undernutrition and overnutrition has become a critical component of what we call double duty interventions. After Mexico's evaluation, which Dr. Colchero will talk about, we really had a huge increase of 35 countries added sugary beverage taxes within the next 4 or 5 years. And we are seeing that increasing globally every year. We added 3 or 4 just this past year. And so countries are using that as one of the low-hanging fruit, but we're moving beyond that, as we'll talk briefly later. The front of the label profiling is moving even quicker. So now Mexico, Israel, and Uruguay also have laws passed and are implementing front of the label warning systems, along with Chile and Peru, and other countries have mixed versions that are mandatory, and many voluntary ones linked with industry-promoted approaches. But one of the things that we've noticed and that we're really promoting is policies that reinforce each other. And Chile is the best example of that. They created a nutrient profile system that identifies ultra-processed foods that are higher in added sugar, added sodium, added saturated fat, and if they're high in any of those, high also in energy density. And from that, they're using it for a front of the package warning label system. It will be shown, that system, it was linked to next Tuesday, there'll be a launching of a PLOS Medicine paper that shows 25% reduction in sugary beverage consumption per capita in the first year after this laws were promoted, among the highest country in the world in terms of per capita consumption of sugary beverages. There's also the marketing restrictions. They first did them on children, found that the child marketing restrictions were, the ads were just pushed into adult marketing, and the kids saw a lot of those shows. So then they put in the total ban from 6 a.m. to 10 p.m. on marketing and in media in the country. And then finally having the same warning label used. Anything in the schools cannot be marketed or cannot be sold or consumed if it has a warning label on it. And soon the government's now working on something that Arantxa and I were involved in, helping to create a very large tax on these warning label foods. Thank you. And so I give it now to Mira.
Okay, I thought, Barry, you were going to talk about the lessons as well, but that's fine. That's all right. So, as I said earlier, the evidence base is growing. It's not perfect as yet, but we are learning from what countries are doing. And we've identified four sets of lessons that have been learned. First, as Barry was starting to say, we need to continue to document the evidence, especially on front of package labeling, marketing, and all of these things on not just consumption of unhealthy foods, but also revenues and health outcomes as well. That's an area that we need to continue to work on. A second lesson we've learned as Pia Schneider, who is one of our experts on designing taxation and has worked, and I see Paul Eisenman is in the room as well, who worked on tobacco taxation. We're learning from the tobacco efforts that when we implement these diet-related taxes, and also when we do nutrient profiling, we want to do it as part of an overall health promotion and healthy diet strategy, and with a coalition across society, not just one sector, but really, and civil society has played a very important role in most of the countries around that. Third thing is to think about a regional approach, so that not just one country. We're seeing this happen in Latin America, for example, quite a bit. We were in Saudi Arabia in November, and the GCC countries were there, and they want to do something and at a wider scale as well. So a regional approach helps in many ways, both in terms of cross-border tax evasion, but also maximizing the impact of marketing controls and so on and so forth as well. And then, of course, you want to coordinate and sequence these diet-related taxes with other tax reforms as well, not just as a separate thing. So those are some of the big picture lessons that we've learned. So going forward, from the bank's perspective, what we've learned from this is that we want to support countries at all income levels, not just high-income countries. We're getting requests from countries like Saudi Arabia to provide them advice, and that's great. And I think other countries will learn from their experience. But we also need to work much more with some of the lower-income countries and middle-income countries as well. And then, of course, it has to be collective public action. It's not one agency. Mohammed said that already. But really transforming the advocacy that we are all generating together into tangible actions. Again, Mohammed mentioned this from the bank's perspective. We have a range of tools that are available. We have advocacy tools, and today's event is one of those tools. But we also have investment tools. We want to be able to do that. We also have some very special tools like development policy operations, which can really support policy change, change in legislation, taxation, things like that, and using more what in Bankese we call DPOs to push on this agenda is really important. And from the government side, as well as the partner side, really a whole of government and a whole of partner approach, not one ministry, not one sector. And that's why, as we said earlier, the transport sector, the agriculture sector, of course, macro fiscal and education sectors are really important as well. And we want, well, our dream is that this is not going to be small tweaks on the margins, but really that we go in with real transformative approaches and additional resources dedicated to this agenda. So 3 areas that we believe from the bank side we will be focusing on. One is, of course, leveraging the range of tools that I mentioned from the bank side. Second is scaling up the promising interventions that Barry laid out. And thirdly, really building the evidence base, because we have to learn as we go along. We don't have all the answers as yet, and we probably won't have them for some time. But we do have promising interventions. We've also, and I'm almost finished, we've also identified 5 areas for further research, both by the bank, but also by other partners as well. Evidence, 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 absolutely critical. But the other area that, as we were doing this work, is we realized there's very little information on is quantifying the climate co-benefits of investing in this space. There's very little evidence as yet, but it's critical as we go forward to do more on this. Food systems. We know we need to act in this space. We're still struggling to say exactly what it is that we can do. And some of those things Barry laid out in the menu of options that we have, but there's a lot more that we would want to do. Engaging the private sector is absolutely critical. And I know Arantxa, when she speaks, will talk about how important it has been in Mexico to be able to do that. Barry referred to the Chile example as well, how important it has been. This is not something that the public sector can solve by itself. Really need to engage with them. And lastly, because we are at the World Bank, and as all of you know, the bank has been pushing a lot on building human capital. And the current Human Capital Index has something on adult survival rates. That's a component of the Human Capital Index. But how overweight and obesity contributes to that, quantifying that is really another area of work that we would like to continue to work on. Now, this is not something that we want to do here at the bank. We're appealing to all of our partners in this room, online and everywhere else, to help build the evidence in this space. So with that, I'm going to say thank you to all of you for being so patient and listening on. And I really want to recognize the government of Japan, which has been absolutely critical, not just in financing this work. And if you haven't seen, for the folks who haven't seen a copy of the report, you can download the report online. But also the government of Japan has been, Japan has the lowest overweight obesity rates across the world, or across all OECD countries. I think, as Mohammed said, we have a lot to learn. 3.7%, if I'm not mistaken. That we have a lot to learn from Japan on that. But also, we have Ambassador Sugada with us this morning, and I want to give you a moment to say a few words about this work, but also about something really important. I won't say what it is, but you're going to talk about it. So let me give you a mic. As you wish, whatever you wish. You want to come to the here? Or you want to speak? Whatever you want.
All right. Thank you, Dr. Shekhar, for that very kind introduction. And thank you, Dr. Popkin, and everybody present today, and those who are online on stream. I want to say just a few words how much we appreciate this opportunity. And as sponsor of this project, I'd like to thank, first of all, World Bank for the timely launch of this report and for convening this event today. Good nutrition lies at the heart of economic and social development and is the key to reducing inequality and eliminating poverty. Nutrition for Growth Summit that our government will be hosting later this year is our opportunity to drive greater action toward a collective vision for 2030. Today's report will provide an important input to the summit and will enrich and broaden our understanding of its impact on human capital, healthcare, and the national economy. I would like to again thank Dr. Mohamed Pate for your leadership, personal involvement, and the excellent team of experts for bringing together the science evidence, which we hope will drive policy and investment action. And I would also like to especially thank Dr. Shekhar and Dr. Popkin and their team for this excellent work. I would like to take this opportunity to share with you our idea on how we intend to structure this summit later this year. The dates for the summit are December 17th and 18th. Actually, this is pending final clearance, so we have not announced it yet publicly, but it will come out soon. And we will be sending out invitation to all the experts and stakeholders and also government representatives and private sectors as well. So this will be a very big event for nutrition. And in July this year, just before the Tokyo Olympics Games, the Gates Foundation will host an SDG Goalkeepers event and the Nutrition for Growth Goalkeepers kickoff event in Tokyo to build the momentum towards the summit in December. We are thinking of three thematic angles to approach nutrition. One is health, the second is food, and the third is resilience. And there will be two cross-cutting issues: data-driven accountability, and finance. This year is, as I mentioned, is a super year of milestone events on global issues. We have the UN Ocean Conference in June in Lisbon. We have the Biodiversity COP16 in Kunming, China, and also the Climate COP in Glasgow. And the finale, of course, will be the Nutrition for Growth Summit in Tokyo. But the important point I would like to stress here is that there is that the themes that we are going to discuss throughout the year, they're all interlinked with each other. For example, the Nutrition for Growth and the Ocean Conference in Lisbon, for the preparatory meeting for which I just attended a few days ago in New York, these two will be thematically interlinked through the keyword food. Because a marine diet can drastically strengthen our food production capacity. However, to achieve this, we will need to adapt food production to climate change and solve challenges such as overexploitation and wild fish catches, or wild fish stocks, and ecosystem degradation and feed demand in aquaculture, and so on. So as Dr. Shekhar mentioned, there is still an unknown sort of area where we need to further dissect and analyze these broad, overarching sort of theme, which links these very important aspects of the global environment. So I would like to thank once again for this very important analysis on obesity, and we look forward to working with our nutrition partners, both private and public, and all the stakeholders, so that we can generate a strong collective commitment from the international community at the summit in December in Tokyo. Thank you very much.
Thank you very much, Ambassador Skada. You have a lot riding on your shoulders. 2020 is the year for nutrition, and you can be assured that this community in this room and beyond will stand behind you to help you make sure that the event is a success. Can I now invite the panelists, Marie, Ruel, and Arantxa? Do we have you online? Are you connected? If you are, can you say hello so that we can hear you? Please.
Yes, hello everyone. Can you hear me?
Yes, we hear you and we see you. Wonderful. Thank you for joining us. And Marie, yeah, come on. Barry, you want to join us? Mohammed, you want to join us on the podium as well? Hello. So what we are going to do now is ask Marie and Arantxa to talk a little bit about what sort of similar efforts that are ongoing. Arantxa particularly to focus on what's happening in Mexico, which is a very important country. They've made a lot of strides. And then Marie to talk about the report, the Lancet report on the double burden that was done by WHO quite recently, led by WHO, but Marie was part of that effort. So let me start with unfortunately, one of our ministers from Pakistan is not able to join us today because of logistical issues. But let me start with you, Arantxa, since we can see you and you are online, to ask you the question that, as you know, and as many people in the audience knows, Mexico has been really at the forefront of this issue. What has worked in making things happen in Mexico, and what have been your challenges? Over to you. Yeah, you're muted, Arantxa. Can you unmute yourself, please? Arantxa is the associate professor at the National Institute of Public Health in Mexico. Go ahead. You want to try and speak now?
Hi, can you hear me?
Yes, now we hear you. Over to you.
Thank you.
Thank you.
Okay, so let me talk about the Mexican model. You mentioned that Mexico is on the forefront, and for several reasons. One is that the academia, so particularly INSP, the National Institute of Public Health, has been documenting for a long time the prevalence and trends of obesity overall by age, by place of residence, because INSP collects the National Health and Nutrition Survey, and we also have documented the quality of the diet. So, for example, why taxing SSB in Mexico? Because we knew that the SSBs and non-essential energy-dense food contributed about 21% of total energy on average in Mexico. So these, the contribution of the research that INSP has done has contributed to the design of policies. So that's one thing. And the other thing is that we have provided evidence and impact evaluation on some of the strategies. And the second part of the model is that the social society has been pretty active, convincing not only the public, but also the Congress, members of the Congress, which is very important to push for a policy. And of course, the relationship with the government is has been sometimes, depending on their position, it's been easy, and we work in collaboration with the government. Sometimes they feel the pressure and things change. But so the Mexican model also is about believing that it's not about only one strategy. Is a different strategy we will be able to move and reduce obesity. And so in Mexico, what has worked? So we have documented that the taxes to SSBs and to junk food had led to reductions in consumption. So prices increased, consumption was reduced for SSB 8% in the two first years of the implementation. The poor and those who consume more were, we found that the reductions were great among them, which is very beneficial, and that we showed that it didn't have any effect on employment, and that there were some potential benefits on health. So taxation has been successful in Mexico. We have conducted impact evaluation. Taxes are pretty low, so we are pushing for increases in taxes because we believe that consumption can be reduced even more. Mexico also has regulations in schools to regulate what food and beverages are sold. So the results are mixed. There's no one impact evaluation. And the problem is that there's no responsible for monitoring compliance. But we have a good regulation, but we need to monitor better. Since 2014, there's been regulation to marketing to children, which there's compliance, but the problem is that it's limited in terms of the hours that it covers, so it has to improve. You know now that we are in a different environment, so to speak, because the government, particularly the Ministry of Health, Economy, and the Ministry of Finance, they're pushing for the front-of-pack labeling, which was approved by the Congress, and hopefully the guidelines will be published soon, and we will have a very interesting strategy, even stricter than the one that Chile has. So the interest will be to conduct an impact evaluation, because we need to see how it works in Mexico. We know how it worked in Chile. And of course, again, our big challenge has been the opposition from the industry in Mexico. We have been really fighting, because the industry has always been against these strategies, particularly taxes and other regulations. And we know that and for this process of the front-of-pack labeling, the government has been discussing with the industry every part of the norm, of the regulation, of the guidelines, and so it has been very interesting that they've been talking, and they have some consensus, but there's opposition. But finally, because there's so much support in Mexico, that we think that it's going to be published soon, and it's going to be very interesting. Of course, Mexico has always been supported by WHO and UNICEF now, and FAO, and of course now the World Bank. And one thing that is interesting now in Mexico is that there's a group led by the Ministry of Health, Agriculture, and Economy, leading a very broad proposal to not only improve taxes and other regulations, but also to change the food system. So the idea now is to think about strategies to change the food system, to subsidize local producers so they can produce healthy food, and then link that to schools, so the schools can have these foods. So right now there's a very big group that is working on different strategies and proposals, and multi-sectoral proposals, and we think that this can this can be very interesting. So now we have a different relationship with the government, and we still need to work with the industry.
Yeah, great. Thank you very much, Arantxa. We'll come back to you with questions, so stay with us for some more time. I now want to pass it on to Marie Ruel. Marie, I know you were part of the Lancet series on the double burden, and Mohammed referred to it earlier in his introduction as well. So tell us a little bit what resonates from today's discussion and the Lancet series. Over to you. Thanks.
Yeah. Good morning. So the question I had received online was by email was, if the two documents or the series and the obesity report actually align on what they're covering and what their conclusions are, and certainly the response to that is yes, they definitely align. And they align particularly on aspects related to the geography, the geographic distribution, and let me just go back 1 second, that the double burden of malnutrition series is about what sometimes people refer to as a double burden, but others refer to malnutrition in all its forms. So it's really talking about the co-occurrence of problems of underweight, wasting, stunting, undernutrition, micronutrient deficiencies, co-occurring at the same time with overweight and obesity. Some are in the same individuals, in the same households, in the same communities, and in the same countries. So we do have a serious problem, and as I said, the two sets of documents relate and align on where this is happening. Barry was author of the first paper, which did describe the geography of where the double burden of malnutrition happens, and it's very consistent. It's the low and middle income countries. The lower ones are more affected. It's in sub-Saharan Africa and South Asia, and it's among the poorer. It's becoming more and more among the poorer. And why is that happening this way is that basically when income increases and when countries are doing better in terms of economic development, overweight and obesity start increasing at a faster pace than the reductions in undernutrition. And actually on micronutrient deficiencies, I think we're never making any progress, really. But on stunting, we have made quite a bit of progress, but it's slower. And so what's driving the double burden is really that obesity is increasing, and that's what we're seeing. And so it's not a surprise that they're talking to each other. The focus on obesity alone versus the double burden is telling us pretty much the same story. The drivers are also very similar. I like the slide with the driver that was presented. We also, in the Lancet series, emphasize very much the importance of early life nutrition in utero and in the first few years, the importance of this period for determining all types of problems of malnutrition at different stages of the life cycle. And we also emphasize the importance of diets. It's a common driver of all forms of malnutrition. That's also an important point. And one thing that Mira mentioned, that is the second paper in the series led by Jonathan Wells, described very nicely how the different forms of malnutrition are interlinked, and how early child malnutrition is actually associated with increased risks of overweight and obesity at adulthood. But also he talks about the toxicity of overweight and obesity. If you've been malnourished during early life, you are more likely to get NCDs, non-communicable diseases, from your obesity at lower BMI. So in other words, those who have been malnourished in early life are likely to get obese, and if they do, they're much more likely to have the chronic diseases that are related, the diet-related chronic diseases, than those that were not malnourished in early life. So that also explains why the problem is now happening so much in low and middle income countries, where a lot of people were malnourished 20 years ago when they were young, or 40 years ago. And now they're living in an environment, a food environment that's obesogenic and that offers all the junk foods that we've talked about this morning. So what are the key messages of the Lancet series? Basically, one of the main message is that we challenge the silos that exist in nutrition. We challenge the fact that I've worked on undernutrition on my life. Barry has worked on overweight on all his life, but also on both. But generally, we're associated with one or the other, and we really challenge that. This has not been helpful, and it certainly is getting even less helpful because of the multiple burdens that we are now finding. We call for a change in paradigm. Definitely there's a need for a change in paradigm in terms of how we approach these things. We agree also that failure to have not addressed the multiple types of malnutrition at the same time has led to harm. And the third paper, which is led by Corina Hawks and I, does actually report on some examples of countries and programs that have led to damage done. That is, social protection programs, for example, that either provide food transfers or cash transfer or even food subsidies, have been showing that they may be helpful to reduce food insecurity. Some of those may have been helpful to reduce stunting in young children, but they have contributed to overweight and obesity in adults in the household. So within the same household, you can have a double effect, a positive effect on the child and a negative effect on mothers' overweight and obesity. And we document this for even a recent program, a food aid program in Guatemala, where we, after 5 years, there was a maternal and child nutrition program and health, and it distributed a lot of food to mothers and children, mothers during pregnancy and children during the first 2 years of life. And we find a reduction of 10 percentage point in stunting. So a big impact of a food aid program on stunting, but it exacerbated the overweight and obesity problem that already existed in the region. And it was poor areas of Guatemala, the mountains, where people are very food insecure in terms of quality, but not in terms of quantity of food. There are other examples. There's also an example from Egypt. It's not only Latin America. There are more examples from Latin America because the problem has been there for a while. Also because they have better evaluations of their programs. I think that's the main reason. And so we find those effects. But there is also the food subsidy in Egypt that was subsidizing for years bread, oil, sugar, tea, and really is associated with both stunting and overweight and obesity and probably also micronutrient deficiencies. So our third paper, as I mentioned, was focusing on the double duty action. So we basically, those have been mentioned this morning, we basically looked at what can we do with the platforms that exist in dealing with undernutrition. So we started with undernutrition. If we don't address some of the issues, if we don't think of overweight and obesity from the start, we might do harm. So what can we do to strengthen the platforms that exist to prevent harm from happening? And so we look at platforms in health, in education, in schools. We look at social protection programs, and we look at agriculture and food systems and food environment. And we have 10 double duty actions which explain how to improve the program, modify slightly. If you take one of those, for example, programs of social protection program, how do you make people not become obese because they receive food? The food is targeted to the child. We know they often share the food, and that's a given. That's why the donor, the implementers give more food, because they know that the food is shared. But if there was an additional layer of education about healthy diets for the whole family, for example, instead of just focusing always on the BCC, the behavior change communication for young children, if we had interventions that were better adapted to preventing both undernutrition and overnutrition, we would refer to that as a double duty action. So there is in the back, not in the back, at the door, I put just a little summary of the series, and there's in the back the 10 double-duty actions. I find that they're not described as well as in the paper. So do look at the papers. It is not a substitute for the paper.
Yeah. All right. Thank you very much, Marie. That was great. So now you've heard from the panelists. I just want to mention we have 165 people tuned in online in English and 52 people in Spanish. So you have a very large audience, and we want to take some questions from them very soon. So if you have questions online, please do share them. Now would be a good time to start sharing those questions. But while those are coming on board, if there's anyone in the room who wants to start off with a question for the panelists, please go ahead. Yes, please. Identify yourself.
Yes, I don't know if we need a mic.
Yes, you do.
Thank you. Hi, my name is Gisela Garcia. I'm from the Independent Evaluation Group of the World Bank. And first, thank you. I think this was pending agenda for the bank. So I really appreciate that this is happening. I actually see this a lot connected to the aging agenda as well. I mean, as we prepare for countries aging at a fast-paced rate, we need a healthy and productive population, and this very much connected to human capital. So I see this as very important for many countries. I have a question maybe for our bank panelist, for Mohammed, and it's related to one issue that was mentioned here. The panelist from Mexico raised that very well. This issue is a sensitive issue for the industry, and the bank usually don't take sensitive issues out loud. We kind of work around this a little bit. So how do you see us moving forward this agenda, given that it's not easy? I mean, we have seen in Uruguay, for instance, the one leading the agenda and the one leading all the changes was the Ministry of the Industry, with the Ministry of Health. But it wasn't the Ministry of Health. It was the Industry Ministry, which is a woman, who was leading and pushing this agenda. Okay. Because the only way was to arrive to in a dialogue, right? So how do you see the bank doing this?
Okay, I think let's collect a few more questions and then we'll respond to those. Let me take a question online because there's so many people online, and then we'll come back to the room. So there's a question from Maria Jose, one of our Spanish colleagues. She says, how can we persuade governments to invest more resources in promotion and prevention activities in order to reduce health spending due to obesity-related diseases? I think that's a really important question, and I'll let the panelists decide who would like to answer that question. Let's take one more question from the room. The gentleman in the back, right there.
Hi, good morning. My name is Ioannis Vasiliou from the Global Practice for Agriculture. I think it was very interesting for me to hear the double positive and negative effect of the cash and food transfers in households. So my question is, given that how straightforward is those policy options, especially for both for our client but also from the bank side, to deal with stunting issues, etc. What could be the alternative, or what should be added to those programs to somehow mitigate the issue of the negative impacts of those interventions without making our life too complicated, because that would be also a disincentive.
Okay, all right, thank you. So I think let's pass these three questions to the panelists. Mohammed, you want to start with the bank's perspective,
yes,
please?
Thank you. I'll start with the easy question from my colleague from the IEG. I think your question reinforces the point that we made, that it will take all of us it's not only one entity that will solve this major problem on the global agenda. And the bank is a key player in that, along with other entities that have been doing this. But also, the model that we operate on is actually built around country demand. And as we speak, there are more than, I think, 40 countries or thereabouts that are trying to sort of get in this space around the policies to restrict consumption of unhealthy food products. That is something that I think we should position ourselves to help them build the evidence base and let that guide the actions that they take. In some areas, of course, like tobacco taxation, I think the evidence is far more clearer. And here, I think there is some nascent evidence that is emerging, as we've heard from our experts, that in fact we should push ahead. But the point that was made in the presentation by Mira was that let's document the evidence. And I think that's where we are focusing on. Let's gather evidence. Let's see what's going on in terms of both not only the consumption, but also the impact on health. So I think it's an effort that really includes the bank, but goes beyond the bank. And you gave the example of a country where the Ministry of Trade and a leader was taking charge of this. And we would see this happening more as the evidence gets more solid. Thank you.
Thank you, Mohammed.
Can I just add a very quick comment? One of the complexities we've had is that in every country that we've talked about as examples, and there's now a good number in Latin America, Africa, and elsewhere doing strong policies, industry has fought them, be it the beverage sector, the industry lobbies. But when we've had the regulations, we haven't seen industry lose employment despite all their cries, because they have substitutes and they can shift across. So how does the bank deal with that issue? Because without the regulations, we don't get these changes.
Yeah.
I think, there are certain instruments. The toolbox that was mentioned by Mira, I think is one where that also brings the toolbox of the bank, but also linked to the country policy environment, and sort of really push where we can enhance the regulatory system to get to the outcome that affects overall population health.
Okay, great. Marie, you want to speak to the double duty? And Arantxa, I'll come to you after that. I have another question for you too, Arantxa, coming online.
Yes. So on in the paper, in paper 3, you will see that we discuss, we have a good section on specifically on social protection programs and on the cash transfers and food transfers per se. And then we have online appendices where we describe some case studies. So we have the case study of Mexico, Progresa Oportunidades, that did lead to an exacerbation of overweight and obesity, or it's certainly documented that it was associated with greater obesity among women. And what we wanted to document was not just the problem that the program did harm, but that they also did a whole overall of their program. Unfortunately, it now closed, but I think the story of what they decided to do to deal with it is very interesting, and certainly Arantxa as well could comment on that. But they basically designed a new strategy for healthy diets, a new behavior change communication strategy, as I said before, that's not just focused on infant and young child feeding practices, but that targets the whole family and talks about healthy diets and how to budget and et cetera. They also had a conditionality, as you know, in the Progresa program to go to the health services. And so, of course, now they go to the health services and get diagnosed for communicable diseases and for overweight and obesity, et cetera. So those examples are examples of a country where they identified the problem and they tried a solution, and the program was working for a while and then was closed, unfortunately. But there are examples. There are other examples in the paper that talk about programs that have done something.
Yeah, and there are lots of questions coming too. So let's make time for Arantxa. You want to answer one of the questions there?
So I wanted to say two things. One is that I think we shouldn't put so much onto obesity as an indicator of success, because obesity is very difficult to reduce, and sometimes countries don't have data to show if there was a reduction in obesity. Those who are obese, it's very difficult to make the change, but it's more in terms of prevention, maybe. Children and adolescents who probably there's prevention there. And of course, if we don't have a big comprehensive package of interventions, then we won't be able to reverse this obesity pandemic. So that's one thing I wanted to say. And of course, something that is missing, and this is something that countries will go through, and Mexico is very interested, is not only restricting what is not good, but then incentivizing healthier options, even because adolescents would respond better if you tell them what, and if you incentivize healthy options. So a combination of restrictions and incentives will really put us in a different front. And of course, we are looking for changes, real changes in food systems. It's not easy, and keeping the environment safe also. I'm sorry, I lost the connection and I didn't hear the question for me, Mira.
Well, I think there are lots of, you've just answered the question that was for you. Okay. And there are so many questions in front of me that I request everyone to be brief so that we can get to many of the questions that are coming, both in the room and online as well. One other question online is that the dramatic rise in rural areas is a surprise to me. It's from Sasha Lamstein. Is it just that the rates were lower in rural areas until recently and they're just catching up to urban areas now? I think that's a question for you, Barry. But let's get to that. I'm going to pose a few other questions. There was Felipe, do you want to speak about the transport sector? Because I think take a mic, please. Yeah.
Very briefly, Mira, we are very happy to have contributed to this report. We see a lot of connection in our practice, and that connection about the built environment, the mobility, behavior of the people, the physical activity, and of course, health outcomes as obesity. We are, of course, just a quick statistics, overall, globally, cities, compact cities, like more than half of the trips of the population are less than 3 kilometers, trips that could be made, by walking or cycling or by a combination. If you do those trips, by walking or cycling, you're just doing, the minimum physical activity recommended by World Health Organization and stay, in good health. So it's something that we want to promote. From our practice, we are putting a lot of efforts, analytical work, to combine our urban transport operations with infrastructure that encourage cycling or walking. But of course, urban planning is a key issue. If we continue planning cities that are sprawled, that are, single use, so we are basically planning for mobile only mobility option, and that's a key part that we're working with the urban GP, how we can also encourage urban planning and practices that also encourage planning that is more compact, mixed use, and induce active mobility. So that's our contribution. I think there's a nice piece, a box about the relationship of active mobility and health issues in chapter 5 that I encourage you to read, and feel free to reach out if you would like to explore further collaboration with our practice in this area. Thank you, Mira.
Great. Thank you very much, Felipe. And I think the work that the transport sector is doing in building bike paths, for example, the Cyclorutas program in Colombia, are really important parts of this puzzle that we are trying to solve. Let me read out a few more questions. I'm going to put them together. There's a question from Judy Canoiti from USAID. Lots of questions from USAID. One is, what role does breastfeeding play in the Mexican strategy? strategy. Clearly, Arantxa, you're going to help us answer that. And then also from USAID, much of the evidence about effectiveness of interventions like taxation and labeling use consumption or sales of unhealthy foods as the outcome. What do we know about the types of programs work to reduce overweight and obesity? And I think Arantxa already answered that question, that obesity and overweight is much harder. It will take much longer to answer that, to get to that evidence. But if we can reduce consumption and sales of unhealthy foods, we're already on that path to success. And one more question, and this one, Barry, maybe you want to answer. What would be the strategies to tackle overweight and obesity among school children in particular? So with that, I'm going to hand it over to the panel. Arantxa, you want to go first? And if you can be brief, then talk about the breastfeeding issue and talk about, the breastfeeding issue primarily. You've answered the others.
Yes, in Mexico, breastfeeding is pretty low. And we have documented how much this is a burden for the country. And so this is a pending issue, and we know that the government will be working on that, on promoting, and the thing is promoting from the beginning, from the first day the child is born, and because hospitals usually they feed the babies with formula. So this is a pending issue in Mexico, and there have been some efforts, and now there will be promotion of breastfeeding from day one, and helping mothers, and also in other social programs.
Okay, thank you. Barry, you want to take the school question and the increase in rural areas?
Yeah, so very quickly, on the rural area issue, this is a global statistic, but it very much relates to modern technology reaching rural areas across the globe later than it did in the urban sector and the manufacturing and other. And we've modernized and we've cut tremendously activity down. At the same time, ultra-processed foods and junk food have reached every rural village and nook and cranny in the world. You can't go someplace in the middle of the hardest to reach county in China or sub-Saharan Africa and not find ultra-processed food sold, much more than any healthy food. In fact, usually if you go to these little stores, stalls, it's mainly ultra-processed food that they're selling. So that combination is deadly. We can't go back to in agriculture to old-fashioned technologies, but we certainly in food can try to change what they're doing. On the other question on school kids, the biggest sets of interventions are threefold. One is the marketing in schools, removing it of all the ultra-processed foods, such as Chile, Israel, and around 36 countries are doing today in one sense or another. The second is not allowing ultra-processed foods into the schools or consumed by the kids in any way, and educating the kids about that, which is something that Chile's evaluations have shown to be very impactful. And the third, of course, is the most complex, which is creating healthier food and feeding in the schools. Brazil's model is one where they required 30% real food from local farmers, and another hunk of food, 40%, to be real food, is one model, but we haven't evaluated that. It's very complex to implement, but it's a very promising intervention, both for local employment as well as for healthy eating.
Okay, thank you very much. And just to add to that, I don't know how many people are aware. Do you want to guess which is the country that has the highest consumption of instant noodles, in per capita consumption of instant noodles? Does anyone want to make a guess on that? India. Nepal. Isn't yeah, a country that has such an amazing diverse food system is hooked on to instant noodles because of the things that Barry just mentioned. So this is the battle that we are dealing with. And moms are working, as Mohammed was saying earlier. More women are getting into labor force, which means they need more convenience foods or quick foods. And this is what is changing food systems in many of the developing countries that we are talking about. There are lots of questions online, but we are running short on time. I'm going to take 2 more questions in the room. I know, Lucy, you've been, and the gentleman in the back. You have to take the mic, please. John's going to.
2 quick questions. Most of these recommendations.
Say who you are.
Lucy Sullivan, Feed the Truth. Most of these questions most of the recommendations are targeted to governments. So what would you say industry needs to do? And Barry, you, I think, rightfully point to the role of ultra-processed foods as a culprit, if not the culprit, in the skyrocketing rates of obesity. And so curious about the data that we have in terms of showing the correlation between the rise of obesity, rise of ultra-processed foods, and where more research needs to be done in that area. Thank you.
Okay, while the mic is going to the next person, I just want to say we have viewers online from Tokyo, Toronto, Honduras, Rwanda, Nigeria, South Africa, Chile, Zimbabwe, Brazil, and of course Mexico and many other countries. So Alex, remind me if I missed any countries. But it's amazing to see the interest across the world on this issue. Over to you, please.
Thanks very much. Keith Martin, the Consortium of Universities for Global Health. I hope that sustainable food systems will be part of the COP16 for all the reasons that Ambassador Sugata mentioned. It's a very large problem. The question I have really deals with Arantxa's central point, which is we have an abundance of solutions, but at the end of the day, these are political choices and political decisions. So and I think there's a huge opportunity to connect the rate of return, particularly on NCDs, to give finance ministers what they need to combat the huge forces that are going to be in opposition to what we're talking about here. So my question is, have the rate of return been determined for some of the very powerful solutions that you've identified through your reports, so finance ministers will have the tools to combat the type of opposition you're going to find? Thanks.
Yeah, maybe I can try and address that last question and then come back to the panelists. I think the rates of return per se have not been documented in detail as yet. But what has been documented is that these obesity-related NC, non-communicable diseases, are leading to much higher healthcare costs in many countries. Will these interventions lead to the high rates of return that we would like to sell to finance ministers? We are not quite there as yet, but that's something that needs to be done. But maybe, Mohammed, you want to speak about it now or in your closing comment?
I wanted to bring in agriculture colleagues.
Okay. All right. Asa, you want to say something?
Yeah, no, thank you so much. So my name is Åsa Gertz. I'm from the agriculture sector here in the World Bank. No, I just want to agree with everything that has already been said. You already touched a lot on the agriculture sector and the food system. Just to maybe add that, I mean, the food system, or especially the food environment that we are in today, is not a coincidence. It's the result of decades and decades and decades of agricultural policies that has really brought down both the price of like cereal-related products, which much has gone into these ultra-processed foods, but also the livestock sector, the industrial livestock sector, and it has crowded out the investments and the production of more healthy alternatives. So I think, I mean, today, I don't know for how many of you that knows, but it's over the agriculture policies globally amounts to more than $500 billion annually. So from the agricultural sector side, both because of nutrition, but also because of the climate change impacts, we're having these discussions with governments about trying to shift some of these agricultural subsidies into more healthy foods. Because I also want, excuse me, I also want to say that even though, and touching upon what Arantxa said, is that even if we do tax a lot of the ultra-processed food or the unhealthy options, we also need to avail more healthy options, and especially to low-income people, to in areas that are not necessarily connected, and going also back to what is happening in the rural areas, but also in different parts of urban areas. There needs to be investments in the logistics systems, because these are any fresh produce which is healthy for us is also very high risk for farmers, right, to do this, because they're perishable. So you need to have the investments, and so that needs to be focused. And then also just to agree on the returns. I think in our discussions with the ministries of agriculture, ministries of finance, because you on the health side will see the negative effects from these agricultural policies, right? So there has to be this connection of what is happening in the cost to societies. And I'm wondering if maybe, as we discussed before, maybe the climate change the impacts on climate change will be a connecting points for these two sectors. So thank you so much.
Excellent. Thank you very much, Asa. I think particularly your point about agricultural subsidies, which, as we've discussed with Jürgen many a time, those subsidies are misdirected at the moment. They're actually doing more harm than good. And so can there be a way to repurpose those subsidies to healthier foods that Arantxa mentioned? $500 billion is not a small amount, and I think we have a lot to do as we move ahead. I'm going to hand over to Mohammed to close, but just before I do that, just to mention that if you are online, and we know a lot of you people are online, please continue to post your questions, and my colleagues are answering questions online and will continue to answer questions online. Also, the whole event has been recorded, and you can replay it within your communities and institutions at any time from now onwards. I think it will be available for several days. It will be there for a very long time, so you can replay, you can continue to have more discussion. I understand there's a lot of conversations happening on Twitter as well, so please continue. We need that collective thing. With that, I'm going to hand over to Mohammed to answer some of the tough questions that were raised. Thank you, Mohammed.
Thank you. I think I will just close. We've had a very rich conversation here with lots of good nuggets from our experts who've co-authored the report, bank colleagues, but also the whole community here, but also online who've contributed to this. I think certain things have been elucidated very clearly. One is that low and middle income countries really have an increasingly larger share of the burden of obesity. It has huge economic costs, both now but also into the future, and that it will take a whole of society approach. But at the same time, we know that there are important sort of lessons and evidence that is being garnered in this area in terms of how we deal with it. But there's a lot more that we need to do going forward to document the evidence as we go forward, for instance, on the impact on taxation on sugar-sweetened beverages and that linked to health outcomes, that we need to also work across sectors within the bank and also out of the bank, also at the country level, as we've heard from Mexico, that all countries at all income levels really have to do something about it. And the role of civil society, I think, was also flagged as a key area in terms of navigating between government in policy, regulation, but also in terms of what the evidence tells us to be able to move forward on that. There are so many important points that were made that I cannot summarize all of them, but the report is out there. The Lancet Commission's report is also out there. This is a kick-off of a conversation or a relaunch of a conversation. And we have the Nutrition for Growth Summit in December. This also helps us move forward in terms of the global community, how we go forward on this to Japan. So I want to thank you, panelists, and to thank Arantxa from Mexico, and thank all of you, the participants here, Ambassador Sukada, and all of those who connected from various countries all over the world. Thank you, and thank you to Alexandra and all those who helped organize this grand event. Thank you very much.